Good evening, everyone. For those of you who managed to join us on this Tuesday evening, a very warm welcome to all of you. I'm Tejas. I lead partner success and health systems for Wellthy Therapeutics. We are India's first and only digital therapeutic company. We are happy to introduce you all today to the first episode of Wellthy Knowledge Series. This is a Wellthy Therapeutics initiative to bring together stakeholders from all realms of the healthcare ecosystem on a common platform and to share knowledge and perspective from their experience on application and benefits of using digital tools and digital therapeutics in their clinical work. So today, on the World Heart Day, we have with us an eminent faculty in the field of cardiology, Dr. Mrinal Kanti from Kolkata, to share with us his experience on the application of digital tools and digital therapeutics. It is our honor indeed to have none other than the President of Cardiology Society of India and an interventional cardiologist who has spent over 35 years in this field of cardiology. Dr. Das is actively associated with NGOs also in this field, who are working incessantly towards the benefit of patients and the community. And on behalf of Wellthy and all of us over here, I would like to thank Dr. Das for giving us his valuable time to share his views on digital therapeutics and how we can help improve outcomes across the cardiac continuum. So with that, I am passing the baton over to Dr. Das. Good evening, Dr. Das, and we are all keen to hear your views.
I'm Dr. Mrinal Kanti. I'm very thankful to the organizers, Wellthy's, for giving me the opportunity to talk on a very, very relevant subject, how digital therapeutics can improve outcomes across the cardiac continuum. It's a huge subject. I'll not go into the detail of it. I'll touch upon certain points in relation to the digital technology being applied for diagnostics as well as therapeutics. As you can see, that the first slide is showing an empty stadium. This is in fact the Eden Gardens at Kolkata. The IPL season is going on, but there are no people, no spectators, no cheering up at the stadium. Why? This is because of the fact that we are passing through a very, very challenging time with the COVID-19 pandemics. And COVID-19 pandemics has shown us many negative things, but at the same time, it has also given us the opportunity to use the digital technology in the best possible way. As you can see from this slide, cardiovascular diseases are very much highly affected and very much highly associated with the COVID-19 morbidity and mortality. And those patients who developed cardiac injury had actually significantly more number of chronic medical illness in the form of hypertension, diabetes, coronary artery disease, heart failure, chronic kidney disease, cancer, COPD and all. And there is an increased mortality. As you can see that the hypertension forms a very, very formidable group. And this is a slide to show that when the cardiovascular disease is associated with elevated troponin T, the mortality is as high as 70%, as compared to without cardiovascular disease and normal troponin T test, where it is hardly 8%. So almost 9 to 10%, 10 times increase in the overall mortality in case of COVID infection with cardiac diseases. And in between there are certain other statistics. And more so with the hypertensive group, you can see that as compared to the normal cohort, with the hypertensive cohort, it is almost double. It is almost, hospital mortality is almost double. Now, what does actually cardiovascular disease mean? It's a conglomeration of diseases comprising coronary artery disease, chronic kidney disease, peripheral vascular disease, cerebrovascular accident or strokes, heart failure, arrhythmias, valve disease, etc. And there are many factors responsible for developing the coronary artery disease or cardiovascular disease. They may be non-traditional and they can be traditional factors as mentioned here. But out of all these factors, the major cardiac risk factors are age, family history of coronary artery disease, hypertension, cigarette smoking, then hypercholesterolemia, low HDL cholesterol, high LDL cholesterol, obesity, and some of them are modifiable and some of them are not. And these modifiable factors can be again in the form of behavioral and biological factors, as I have mentioned here, and they actually can be modified. How we can modify? We can modify by therapeutic intervention. And here is the importance of the digital technology, which Wellthy has come forward with a beautiful app and communication system where the modification can be done on instantaneous basis. So, ladies and gentlemen, you can see that if we control the cardiovascular disease, we could have controlled the corona-related mortality. And that's why actually World Heart Federation has come forward with the theme, use heart to fight corona, use heart to fight cardiovascular disease. So we can use our heart, the metaphysical or metaphorical heart, to control our structural heart disease. So that is the learning we have learned from actually the COVID-19 infection. And it has shown that we failed miserably in taking care of our patients because of many factors. It's not just a single factor, many factors. Like there was 53% partially or completely disrupted services for hypertension treatment, partially or completely disrupted services for treatment for diabetes and diabetes-related complications to the range of 49%, and 30% partially or completely disrupted service for cardiovascular emergencies. So there has been reduction of our capacity because of the corona effect. And these disruptions, shortages of medicines, diagnostics, technology, and all these have actually told upon our morbidity and mortality associated with COVID-19. And it is not just specifically associated with India, a lower middle income group of countries. It has affected globally, and it has shown us that you are concentrating on the non-communicable diseases, ignoring the communicable diseases. So nature has given the challenge. Now take care of everything in holistic manner. That holistic manner of therapeutics can be taken up by internet and smartphone, which has grown exponentially in the past decade, opening up the possibility that these increasingly prevalent technological tools could improve health in many aspects, as it has shown in the cascading manner. Mind it, one of the very, very important factors for all cardiovascular illnesses, or for that matter, any illness whatsoever, is the lack of adherence and lack of compliance. And this lack of adherence and lack of compliance can be taken care of definitely, and more specifically, not only with the interactions with the doctors, but also with the healthcare providers. and the smartphones have given lot of inputs and lot of chances to do that thing in the most effective way. And there are many categories of missed opportunities to improve the cardiovascular care to avoid unnecessary costs. And there is a domino effect. We can reduce the odds of cardiovascular disease by 80% by taking care of the major risk factors, and failure to elicit and follow up with the people's goals and needs, and failure to diagnosis was also obvious, and failure to use proven first line of treatment was also there in case of corona, and failure to use advanced treatments were also there, and failure to provide supportive care was definitely there, though to a lesser extent. And all this could have actually had the dominoes effect, and we could not do the desirable therapeutic aspects. But this corona has given us the opportunity to go for the digital technology to help this group of patients. And thus, digital tools are an effective method to implement actually lifestyle change. And this lifestyle does not only mean the work ethics and exercise and diet and all, also the guidelines for the medications, going to the doctors, therapeutic, then yoga practice, and all this actually will be guided by the digital tools. Just to show you the example of the digital technology helping in the BP measurement, that now actually the machine has been there, digital machine, very small in size. As I can show you, it is just the 2-finger shape size machine, which actually can detect not only the BP but also the SpO2, heart rate, and also can detect, some of the machines are having the facility to show the cardiac rhythm, not only the cardiac rate, I tell you cardiac rhythm, that is the ECG manifestations. So that BP mechanism or the digital technology actually can help you to take care of the BP surge in the most effective way by contacting the doctor immediately. Similarly, the LDL cholesterol reduction also is possible by taking care of the various dietary and pharmacological interventions, and we can have the dominoes effect in terms of reducing the morbidity and mortality. This is a machine very commonly known to us, and the figure can be taken up by the smartphone, and it can be immediately sent to the contact doctor, and he can guide you. But the machine has come, which has been recently approved by the FDA to record the 4-in-1 things like BP, heart rate, temperature, and ECG rhythm. And you can see that the digital technology is surging, and it is all pervading in the cardiac diagnostics. As you can see, even a very, very simple technique like MRI can actually give you the diagnosis of the coronary artery stenosis or coronary artery calcification with the help of artificial intelligence. Same way, the cardiac scar can be diagnosed with the MRI, and same way the technique of 3D coronary arteriogram can be done by the volume CT heart, or the peripheral arteries can also be seen. So you can see that the most of the aspects of the cardiovascular diseases can be taken up by the digital technology. This is a video of actually the intracardiac observation of the structures applying the digital technology as well as artificial intelligence. I am not showing you the detail of the technique, but it is a very, very important innovation that we are actually going for kill actually the cardiac diseases. And same way, the tools can be applied for teaching the pupils based on the app-based education system. As in this slide, you can see the bifurcation lesion is being shown to the pupils to tackle the complex coronary angioplasty. And this is a very advanced techniques, the robotics PCI, which has been carried out for the first time in the world by Dr. Tejas Patel from India, who has shown the angioplastic method can be applied from a distant location to a particular patient. And this is a real advancement and paradigm shift in the management of cardiac diseases. And that leads to us to the concept of precision medicine and as compared to the evidence medicine. And there is a huge knowledge gap. And really speaking, the digital technology and artificial intelligence can help the precision medicine to a significant extent to diagnose. And that has been reflected in the diagnosis of the coronary artery disease and labeling them as low risk or high risk or moderate risk by the genetic study. And these genetic studies are done by taking only one drop from the saliva, and this saliva actually gives the knowledge about the genetic, the genotypes, and they can be guiding us to divide the patient into low risk, intermediate risk, as well as the high risk patient, so that we can manage the patients effectively. And it does not vary over time. It does not vary with meals. It does not vary with drugs. It does not vary with gender, and can be determined by a single test. Thus, it can actually give a paradigm shift to the concept of the cardiovascular illness vis-a-vis the management. And that's why it has been postulated that the heart disease will be eliminated by this century. And these are some of the important advancements in terms of managing the cases of acute cardiac events with the help of the smartphones. You can diagnose the patient with acute myocardial infarction, call your doctor, and ultimately take care of the patient's most effective way by the PCI capable or non-PCI capable centers. And you are now aware that the telemedicine has come of age, especially with the corona effect. MCI has given the guideline for how to use the telemedicine. These are some of the instruments which are required, and you can use them effectively to diagnose. And these are some of the smartphones based apps, and they have been devised by the Wellthys, and they have actually started the mobile and behavioral cardiac health care by taking the actions like motivation and inspiration and diet control measures, as well as advising on the physical activity that are to be taken care of. And we published a paper recently in 2020, hardly 1 month back, based on the concept of the Arogya Setu, which has been devised by Government of India, and that has actually given us the clue that we can track high-risk patient. We can create a national or international-based dashboard, and we can actually have a virtual chat box visits, and the AI-based diagnostics can be applied there, and we can also take the decision regarding the various disorders, and we can protocolize the whole concept. And thus, the digital technology as well as the artificial intelligence can give us the alerts, diagnostic help, and also can help us in information retrieval, image interpretation, mining medical records, designing treatment plans, assisting repetitive jobs, getting most of the technological advances in person and online consultation, health assistance and medication management, as well as the precision medicine. In fact, it can be also used for evolving newer drugs, and also the open artificial intelligence ecosystem, thereby analyzing healthcare system, giving adequate supportive therapy. This is one of the very, very recent developments known as teleporting. I'm going to the video quickly to show you that this technology will be the future, and it will be used more and more, where actually you can see that the doctor you are actually consulting can be there near to your place, and you can actually give all the guidance, take all the guidance from the doctor concerned or the healthcare service provider. And this is the technology which is really coming in a very, very big way. And I'm stopping it here. But the future is all very, very hopeful, and we are banking on the virtual reality. I'll be here as well as I'll be there near you. I'll be shaking your hands, of course, virtually, and that is called the virtual reality. And that is not very future, especially with the advent of 5G and 6G technologies, when the internet speed will be very, very high, which is the prerequisite for the virtual reality. And I'll be presenting the lecture in front of you. You can see me, you can touch me, but virtually. Now, there is a very, very important concern regarding the cyber security, especially when the war-like situation happens. This is a possibility. But till May 2020, there has not been any cyber attack on any cardiac device. You know, there are so many cardiac devices which are used for therapy in cardiovascular illnesses like cardiac arrhythmia, sudden cardiac death, where AICT is used for heart failure, CRT is used for heart failure, advanced cases. The artificial heart is also used. So there has not been so far any cyber attacks, because there was an original adage that whenever a device or therapy comes forward, we must remember that primum non nocere. We can improve upon the technology. We can improve upon the mortality, morbidity, but we should do no harm to the patient. That is the most important aspect of any therapeutic advice, whether it is Wellthy's advice on the app, or whether it is telemedicine, teleconsultation, or any device therapy. So, ladies and gentlemen, this is the summary of my whole talk. That digital technology has actually given a true paradigm shift in the healthcare ecosystem. And new modality of therapies are there to drive actual therapeutic outcome, deliver insights, data-driven therapies, and lower costs to the healthcare system. This is a very, very great advancement. Recent deals between digital therapeutics and biopharma demonstrate potential value of digital medicine. Data and insights can drive value and efficiencies across all of biopharma, from R&D through commercialization. More efficient product development can be achieved with lower cost and shorter development timelines. Digital therapeutics functions as both monotherapy as well as with the combination therapy, especially with the traditional pharmacological interventions in the form of diet control, in the form of exercise, yoga, and all this. And digital therapeutics offer compelling safety profile and may become the new first-line treatment for selected indications. Thus, digital medicine services delivery model promotes the evolution of value-based care, and it allows patients to access care on demand. So with all these, actually, we are going to a new normal, that is the digital technology as well as artificial intelligence or augmented intelligence or auxiliary intelligence, shortly known as AI, are going to influence our healthcare in a very, very big way. And I really conclude my talk by saying Don't ask what your country can do for you. Ask what you can do for your country. And that should be the aim of all the healthcare service providers. And really, I'll be seeing that day that the people will be devoid of the cardiovascular disease menace and will be having a very happy and healthy life. I wish all the best to all of you, and also thank you for patient hearing. Namaskar.
Sir. Thank you, sir. It was indeed, a very enlightening lecture. We are lucky to have you amongst us today. There are, I can see that there are a number of attendees on the call right now, and there are some questions that I see from the audience at the moment. So, sir, would it be all right if we jump into a few of those questions and answer those?
Surely.
So, sir, this is a question that I get a lot, especially when we are speaking to clinicians about digital therapeutics in India. What we've seen in the West, sir, that the FDA in the US has approved a number of digital therapeutics and given them a grade of software as a medical device, because there has been compelling randomized clinical trial evidence coming in that with the use of digital therapeutics along with pharmaco and medical therapy, you can actually reduce the risk of cardiac events and also in some degree halt disease progression down the continuum. Right. With that compelling evidence coming in, FDA has approved a number of digital therapeutics for reimbursement even, right, in the West. With the advent of Corona, and the global pandemic, it has seen a leapfrogging of the, regulators' view on technology for assisting healthcare. Do you see that, with the evidence that is being presented by Indian companies now in this area, there could be a legitimizing of these kind of technologies sooner rather than later in India, in the larger medical fraternity, as well as how the regulatory framework sees these interventions, not as software or wellness, but as medical devices or legitimate therapeutic interventions that can actually bring outcomes. So, would like to hear your thoughts on that, sir.
Yeah, this is a very, very important question, and very nice question indeed. In fact, what I would like to highlight that Arogya Setu has been a tremendous success, and Digital Technology Department of Government of India actually has developed this, and really it has worked to a great extent. Though it has been questioned on many facets, but definitely it has given us the insight how to go about the digital therapeutics. But this is more of a digital diagnostic app rather than the digital therapeutic apps. Say, for example, as you are talking about the digital application and FDA approval, I am showing you one of this kind which has been approved by FDA. This is a 2-finger shape actually device known as Cardia, and this has actually given us the opportunity to diagnose any cardiac disorder, especially in terms of the acute coronary event or arrhythmia, instantaneously. And this actually can help you to diagnose from a remote area just by activating your Bluetooth. If you can send the ECG to the doctor or first medical contact, then this can be taken up for diagnostic purpose. And once the diagnostic is over, and automatically the person will be going to the therapeutic aspects. Now, suppose a person is having obesity, Obesity, though it is known as a sort of a single disorder, but it's not so. It's associated with many other cardiac comorbidities like hypertension, then hypercholesterolemia, hypertriglyceridemia, then sleep apnea. Then also it is associated with various kind of arrhythmias, especially atrial fibrillation and heart failure. Now, a single condition, obesity, is being associated with so many cardiovascular illnesses. But if you take care of this obesity by regular exercising, by regular diet control and all these, and adherence to the principles of the lifestyle modification, then you are the beneficiary. And this is being precisely done by some of the companies like Wellthy's and all, which have developed actually the technological advances in the form of app, and they can actually guide online basis about the various lifestyle measurements, which will ultimately give you the lease of life. So that is to emphasize that this application of digital technology will be very, very helpful in future, and this will be the only way to combat the menace of cardiovascular disease.
Oh, thank you, sir. Thank you for that answer. Sir, another question I have on the screen right now is, a lot of doctors, a lot of cardiologists, have this concern that that if we use digital therapeutics or technology in their workflow, there would be the relationship with patients would get impacted. But I want to hear your view. Can actually using digital therapeutics or tools like these to basically extend your practice beyond the clinic, can this actually help in strengthen the patient-doctor relationship? So what are your views on that, sir?
Well, this is a very, very important question, especially who are with the knowledge of the digital technology or artificial intelligence or application of all these newer advances in any field. We call it is a disruption phenomenon. So whenever there is any initial improvement, there will be disruption of the system. When there was no internet, actually the telephone system was working effectively for communication. But when the internet facility came, the telephone is now gone. Now we are using the mobile phone, smartphone, and also we are using the telemedicine. But initial impact will be later on supplemented and supplanted by the advantages that are achieved by use of these technological advances. Because if you have got your number, then number means number of patients if you are having. Automatically, those patients who will be consulting you with the telemedicine, they will not disturb you in course of time with just asking for, sir, what I should do on this particular aspect of my diet, or what should I go for walking every day or 5 days a week. This sort of very simple questions can be actually answered by the app, and they can be taken care of just at the background of your clinic. So your back office will be always there with the help of the app, and it will act actually helping your bridging with the patient in a more tighter way than ever before. So I am not very much convinced that this will really disrupt the relationship. I think it will enhance the relationship.
Thank you, sir. And I think that echoes the thoughts of a lot of digital opinion leaders we see today in the field of cardiology, what you've just said. And really grateful for that answer. So, we've seen what DTX can do in terms of, some of the evidence that you presented today and the studies that we've seen. We've seen that there is a direct impact on lead indicators like hypertension and dyslipidemia on by using tools like digital therapeutics. But when we talk further down the cardiac continuum, when we talk about cardiovascular events, right, and also cardiac rehabilitation, a few questions that I have over here, they are basically talking about, how adopting tools like these, even when patient is further down in the disease progression, they can help basically keep the disease from progressing or help in effective rehabilitation for the patient. So any thoughts on that, sir?
Whenever I talk about the prevention of diseases, I always talk about 4 kinds of prevention. Number 1 is primordial prevention. Number 2 is primary prevention. And number 3 is secondary prevention. And number 4 is the tertiary prevention. Now, all this can be taken care of by this digital therapeutics. Say, for example, a very high-risk a high-risk person of cardiovascular disease can be assessed even at the childhood level. How? If a person is having his mother and father with the coronary artery disease, or having the stroke, or having the familial hypercholesterolemia, or having the history of hypertension, this particular child can be taken care of from the day 1 itself, from the day 1 of his birth. I tell you how you will give him such diet, you will give him such methods so that actually the hypercholesterolemia does not appear, the hypertension does not develop. How hypertension will be taken care of? By advising the diet which will be having less content of salt. How the obesity will be taken care of? If you don't give the various kinds of trans fats and sugars, then you will see that actually the person or the baby is not developing obesity. So childhood obesity is a very great problem. And this childhood obesity is very, very important in developing the further course of the various cardiovascular diseases. So you can have actually the primordial prevention in that way. Same way, the person has developed hypertension or diabetes or cholesterolemia, then they can be taken care of by appropriate advice with the help of the digital therapeutics. Now the person has developed hypertension, diabetes, cholesterolemia, smoking and all these things, and they have actually gone for the next step of the disease, that is the myocardial infarction. And as you know that the myocardial infarction has so many other facets, especially the sequelae of the diseases, heart failure, arrhythmia, sudden cardiac death and all. And they can be also reduced. The rehospitalization can be reduced by taking care of the various risk factors, adherence to the drugs, appropriate dosage schedule, adjustment, and all this can be advised online by the digital therapeutics. And that's why your chance of developing reinfarction or rearrhythmias or repeated heart failure can be minimized or reduced. Now, the person has developed advanced, cardiac failure. As you know that the advanced cardiac failure, where possibly there is already the cardiac resynchronization therapy or ICD being used in that particular patient, or the patient has the cardiac transplant. That patient might have actually chronic kidney disease because of the associated risk factors. Now, this patient also can be taken care of, which we call as the tertiary care or prevention. So, how? If you advise the fluid amount, how much is the fluid that is to be taken care of in this particular person? And if the weight gain is there, that weight gain is due to the, the fluid overload. By taking a simple measure that you are advising with the help of the digital therapeutics that you should reduce your fluid intake, you should reduce your salt intake, and you should reduce sugar, you should have for very minimal kind of exercise. And with this simpler advices, you are actually reducing the further events, especially the sudden catastrophic arrhythmias and sudden cardiac death. And these are possible. These are possible, and thus actually digital therapeutics can help in all kinds of preventive measures in taking care of the cardiovascular disease.
I think that is beautifully explained. I couldn't have hoped for a better explanation. I hope most of these questions around the applicability of these kind of intervention further down the cardiac continuum is answered by that very well-rounded answer that you've just given us. So I think the last couple of questions I would just take very quickly. I know we are running short of time, but in terms of applicability in India and in the Indian patient, do you see, especially in today's world where we are in post-corona or in middle of this pandemic, do you see that the adoption by patient for such interventions or such products has increased, or is it at the same level at what it was before the pandemic began, and also the acceptance in the larger clinical community? So for acceptance of patients and the clinical community, that's the question.
I think we are not yet adept with this kind of therapeutic aspects, because we have not yet made ourselves, that is the doctors community, aware of these kind of products. We'll have to create more and more noise to have the benefits of this kind of device or therapeutic aspects. And more, if we can actually transmit this information across the community, the global community, especially the doctors and health service providers and even the hospital systems, then definitely it will be used more and more. Because gradually we are seeing that the conference call or the telemedicine is picking up. Gradually we are seeing that because of the corona effect, patients are more adopting the process of non-contact kind of therapy that is being offered by the doctor or the hospital through the digital platform. Since now it is being taken up by the people, so you can see that actually we can extend this facility to the therapeutic aspects also, that is the digital therapeutic aspects also. So that's how, if we can actually make the people aware, we can make the doctors aware, we can make the nurses aware, we can make the hospitals aware about the various aspects of the digital therapeutics. Definitely it will pick up, and definitely it will go a long way in the overall management of the cardiovascular illnesses.
Thank you, sir. So the next question I would like to ask you is, and this is coming from our attendees today, how are digital therapeutics different from wellness apps that are available on the App Store and Play Store? So could you give us your views on that, sir?
Yes. Thank you very much. This is another important question, actually. There are differences between the wellness apps vis-a-vis the digital therapeutics app. The most important differentiating point is that the first one is not evidence-based, and the second one is evidence-based. This is the number one. And number two, you can see the differentiation by experiencing the app itself. They will guide you as per the directions or over a period of time. But in digital therapeutics, you actually get sort of online advice on any aspects, especially the diets, exercise, fluid intake, and the salt intake, the calories intake, and all these things can be can be given to the person who is asking for it online basis or almost 24/7 basis.
Yep. No, thank you, sir. I mean, I think I couldn't have said it better myself. So another one coming from one of our listeners today is, what role can various stakeholders in the healthcare ecosystem play in the adoption of digital tools and digital therapeutics? And the stakeholders that they've mentioned over here is, what role do doctors have? What role do associations like the CSI have? And what role can insurance and pharma companies play in the adoption of digital tools and digital therapeutics? So,
always there is a sort of requirement of synergy between all stakeholders, including doctors, then nurses, then pharmaceutical industries, insurance, even the government agencies also who are responsible for healthcare system. Now, first thing is that everyone will have to know the concept much more in detail and much more in a voluminous way. And now, for that, actually, you'll have to the people who are working on the back office, especially promoting or making the apps, you'll have to make your noise so that you are heard by the stakeholders. This is number one. Number two, education is very important. You see, education, without education, you cannot learn a new technique or new agent whatsoever. Absolutely. Even when a new drug comes, you must educate the doctors and everyone so that they become conversant with the whole thing. Same way, government agencies, especially the various departments who are coordinating, they are also to be convinced for accepting the newer therapeutic agents and newer therapeutic tools. And if the government can be made to hear these aspects, then only insurance industries will be interested to give even insurance benefits to the group of patients who are catering the service even on this digital platform.
No, absolutely, sir. And I think the government is making some efforts. Of course, COVID has been a kind of like a black swan moment. We saw the guidelines come in, and we saw other regulations kind of coming in a hurry. And this has happened not just in India, in many other markets as well. So I think government is definitely leading the way, and we should see in adoption coming in, all stakeholders working together. Recently we also saw the regulator for insurance coming up with new guidelines for integrating wellness and preventive health solutions. So these are all good signs to come for the times to come, right? Yes, sir. So the final one, I think the question that is coming in is that beyond what we have seen today, so what is your view for the doctor community in terms of how digital tools and digital therapeutics specifically can benefit doctors in their day-to-day practice? And what would you suggest the group of doctors who are today here listening to you in terms of adopting tools, how they can benefit and for what they should adopt these tools for?
Yeah, I think the similar question was put previously also, and I will reiterate that the doctors should not be afraid of using the newer technology. They are always supplementing their own kind of therapeutic approach to the patients. Only thing is that they'll have to be computer savvy or they'll have to be app savvy. And if they become this and they use it for greater benefits of the patients and community, then automatically they will find that it is quite handy. Many things are answered by the back office instead of himself being irritated at times because of the time pressure. So that sort of things will be taken care of by the app itself. So in that way, actually doctors will be benefited. Now, for that to happen, actually, those doctors who are to accept this kind of therapeutic agent in their fold, they will have to be educated, they will have to be aware of this, and they will have to actually ultimately be convinced that yes, this is useful, and then only the use will be increased. So that's my take on the whole concept of digital therapeutics.
Oh, thank you so much, sir. There is one more question I think I'll take from the audience, because this is coming up again. A doctor in the audience has asked that are we losing personal touch with the patient, with face-to-face interaction, other human-related factors which were responsible for better treatment outcomes if we adopt digital therapy? So, sir, your views on that? This is coming in from a doctor within the audience.
That's the difference between virtual and in-person, the interactions. So there is always a difference. Whatever I am speaking today in this forum is a virtual presentation. But a day is coming, I tell you, since I'm a little bit involved in various activities of the digital technology, especially the virtual reality and augmented reality and augmented intelligence. AI is nowadays not artificial intelligence. It's an augmented intelligence. Augmented means whatever you are having, human intelligence has got its own level. It has been there for 230 millions of years. I tell you, 230 millions of years were spent for developing the human intelligence. And the digital technology is just a new phenomenon, maybe say 20 years or 30 years or like that. But it is going in a very faster pace. But it is to augment the human intelligence. So that artificial touch will be there. There is no doubt about that. But with the augmented reality and virtual reality, actually you will be present in front of the patient himself. A day will come when I will be shaking your hands, though it is virtually. I think I showed you in my last slide that the virtual reality is coming. It will come only when the internet speed is very, very high to the range of say 5G or plus, that is 6G. I think we'll have to go for 6G straight away instead of not going through the 5G system. So then only you will have the taste of the individual touch, in-person touch, though of course it is a virtual reality mediated one.
Oh, thank you so much, sir. And it was really enlightening having you over here today with us. I understand that World Heart Day is an exceptionally busy day for you, and we are so glad that you were able to make time for this session. And on behalf of the entire audience and the Wellthy Therapeutics team, I would like to thank you wholeheartedly for your time and your views. And good evening, sir, and thank you again on behalf of
Namaskar.
Namaskar.